personally thank the people of this great state for what you are doing to help combat COVID-19 and ask you, in fact, urge you to continue to stay in the fight. Mississippi continues to see increased cases of COVID-19, increased hospitalizations, and a way too high positivity rate. We see early hints that your efforts are working. That is a sign to keep pressing, to keep working hard. It is not a sign to declare victory. I just want you to know that your increased focus is having an impact. You have the power to save lives, or conversely, you have the power to cost lives. Today, I am extending our current executive order for another 2 weeks. And in addition to that, I am adding 8 additional counties to the list of those with mask mandates. Carroll County, Coahoma County, Jones County, Lee County, LaFleur County, Lowndes County, Noxubee County, and Pontotoc County have all now had over 200 cases over a 2-week period, or over 500 cases per 100,000 residents. I want to read them again because this is the most important thing that we will be doing in our executive order. 8 additional counties: Carroll, Coahoma, Jones, Lee, LaFleur, Lowndes, Noxubee, and Pontotoc are the new counties with mask mandates. As a reminder, they join Bolivar, Claiborne, Covington, DeSoto, Forest, Grenada, Harrison, Hines, Humphreys, Jackson, Jefferson, Madison, Panola, Quitman, Rankin, Sharkey, Simpson, Sunflower, Tallahatchie, Tate, Walthall, Washington, Wayne, Calhoun, Holmes, Lamar, Montgomery, Winston, and Yalobusha counties. With these additional 8, that's 37 counties in our state that now are under a mask mandate. As a reminder, we strongly encourage every Mississippian to wear a mask when you go out in public. We tell you that it is best if you wear a mask and maintain social distancing, at least 6 feet away from those that you are around. We can make a difference by doing these little things so that we don't have to shut down parts of our economy again. We are throwing everything that we can at the hospital crisis in our state, and we are going to continue working to ensure the integrity of our healthcare system. I want to underscore this one more time. Even if you do not personally fear coronavirus, the overwhelming of our healthcare systems will affect everybody. If you get in a car wreck, you don't want to be treated in a tent like we saw in other parts of the world, and in fact, like we saw in other parts of the country. You want to get the best possible care. The best way for us to ensure the integrity of our healthcare system is for every single Mississippian to do the little things to help slow the spread of this virus. I've received a large majority of the school reopening plans from districts across our state. I plan to spend a tremendous amount of time this weekend reviewing every one of them. That is my plan, to look at every individual school plan for reopening, and I plan to offer my thoughts on them sometime next week. Going into this weekend, I do want to share a quote from the director of the Centers for Disease Control, Dr. Robert Redfield, someone, by the way, that Mississippians have been in touch with in the days and weeks prior, that I think perfectly puts how I'm trying to approach this. This is from Dr. Redfield of the CDC, and I quote, "It's not the risk of school openings versus public health. It's public health versus public health. And I'm of the point of view that the greater risk to the nation is actually to keep these schools closed. You know, a lot of kids get their mental health services, over 7 million in America in their school. A lot of people get food and nutrition in their schools. Schools are really important in terms of mandatory reporting sexual and child abuse. Obviously, the socialization is important. And obviously, for some kids, I think actually a majority of kids, their learning in a face-to-face school is the most effective method of teaching. That said, it has to be done safely, and it has to be done with the confidence of the teachers. It has to be done with the confidence of our parents. But there's been another cost that we've seen, particularly in high schools. We're seeing, sadly, far greater suicides now than we are deaths from COVID-19. We're seeing far greater deaths from drug overdose that are above excesses that we had as background than we are seeing deaths from COVID-19. So this is why I keep coming back for the overall social being of individuals. 2, let's all work together and find out how we can find common ground to get these schools open in a way that people are comfortable, that they are safe. That was a quote from Dr. Redfield of the CDC. What you should glean from that, and certainly what I do, is that these are exceptionally complicated issues. The reopening of schools in this environment is a major challenge. I get that. I understand that. But to those individuals in our state who say the public health of the spread of the coronavirus is the only risk at play when making a decision about our schools, are ignoring so many other risks that exist out there. Dr. Dobbs and I had a long conversation this morning about trying to find the right answer to mitigating as much risk as possible in the reopening of our schools. We know that we are not going to mitigate 100% of the risk on either side of this equation. And so what we must do is look for innovative ways to reach what we all believe is the right outcome. And the right outcome long term for kids is that they are in an environment that is loving and that produces and provides an educational opportunity. When I think about some districts, and I hope that this is this distinct minority, that would submit to you that they should close for the entirety of the 2020-2021 year, or that hopefully they can do distance learning that is totally different than the distance learning that they did in the spring. What I would say to you is if you take a first grader or a second grader or a third grader or a fourth grader that was already struggling to keep up, and you take them out of the classroom for months and months and months and months, quite frankly, that could have not only an impact this year and next, that could have an impact on that first or second grader's life for the rest of their lives, because they may never catch up. Let's think about this in terms that I like to think about, and that's in terms of mathematics. And I'm going to use round numbers here, but let's just assume for a second that we have 450,000 kids in our schools. That's approximately 35 to 40,000 kids per grade. Let's assume that of those 35,000 kids, that roughly 2/3 of them are doing just fine. They'd probably do just fine in an environment in which they were being taught in the classroom, and those 2/3 would probably be doing just fine if they had to do distance learning. So that leaves somewhere in the neighborhood of 10 to 13,000 kids across the state of Mississippi per grade that really need that instructional help. that really need that extra hand that so many great teachers provide. Let's just assume for a second, rather than 10 to 13,000, let's just call it 11,000 students per grade. Kindergarten through 5th grade, if we go with that 11,000 kid number, that's 66,000 kids in our state. That if we just said, okay, we're just going to shut down schools because we have the spread of this virus and it does increase certain risk, then that'd be between 65 and 70,000 kids, maybe even 80,000 kids in our state that could go 6 months, some 11 months, 12 months without instruction. Mississippi cannot afford, and those individual kids definitely cannot afford, for 65 to 70,000 of our kids to get so far behind that they can never catch up. It's just not realistic. The risk associated with that for those individuals for the rest of their life has to be weighed against the very real risk of the spread of the virus. We know that. We are dealing in a time unlike, I believe, what anyone else in this country for the last 100 years has had to deal with. We are trying to find the right answer to mitigate and minimize risk on both sides of the equation. There is no answer when it comes to schools which says you can assume risk on this side, assume no risk on this side, and so the question should be easy to answer. There is no such solution here. What there is an opportunity to recognize that there are risks to be mitigated no matter the decision. Let's review what I hope to find are innovative ideas being implemented in certain schools across the state. Let's figure out a way to exercise best practices so that we can mitigate and minimize the risks amongst kids and teachers and communities of the spread of the virus, while at the same time minimize and mitigate to the extent possible the very real risk of teen suicide, of things such as kids being malnutrition because of the lack of those school lunch program, things such as the mandatory risk that come with mental health services or the lack thereof if kids are not in school, as well as the very real risk that are sometimes mitigated through mandatory reporting of child abuse and other sexual abuse by kids while in school. So these are not easy answers. There is no right answer. There is a desire by me and many of my fellow governors around the country to try to find the right balance. And ultimately, that's what we've got to find, is what is the right balance to do what's best for our kids across Mississippi. I'm committed not only to the 2/3 of kids that might be able to be okay, I'm also committed to make sure that 1/3 of our kids who might otherwise struggle and maybe never overcome it, that they have an opportunity for success in life. I'm committed to both groups, and I'm going to do everything in my power to make sure that we protect them and mitigate and minimize risk to the fullest extent of my authority. With that, I'm going to ask Dr. Byers to give us an update on today's numbers.
Thank you, Governor. Well, you know, today we're reporting it's still bad out there, guys. We're still seeing transmission. We're reporting an additional 1,775 cases identified today, and an additional 48 deaths. Now, many of those deaths are from death certificate data, but they are deaths nonetheless that are due to COVID. We're still seeing a significant impact in our most vulnerable populations. We're still seeing a significant impact on our long-term care settings. We currently have over 200 outbreaks in our long-term care settings. That's an astounding impact. We dealt with outbreaks of respiratory viral illness in nursing homes and other settings before during flu seasons, but not to this extent. And so we still need to continue to do those measures to protect those folks in those most vulnerable settings. You know, we're seeing a lot of transmission within nuclear family groups and a lot of transmission that's occurring just from, you know, interacting with that family member that you don't see very often, or interacting with folks and family members at gatherings like funerals. And so we're at a point now, guys, and we've said this before, where we need to act as if every single person that we come in contact with has COVID. And we need to act as if we have COVID and do those measures we need to do to protect us from transmitting it to other folks. You know, we know there's a lot of asymptomatic people out there that can transmit the infection. We know that there are people out there who may have minimal symptoms and never even recognize that they're infected. Wear a mask. This does prevent transmission significantly. In addition, we have 972 confirmed cases that are currently hospitalized, and an additional 273 of those cases that are suspected COVID-19 positive. Even though we've seen some bit of leveling in the amount of hospitalizations, that's still astoundingly high. We have, if you look at the Jackson area right now, when I looked at the data before I left, 4 ICU beds available. And so not only does that have an impact on the people who are going in for COVID-related illness, but as Governor said, also those people who need ICU and hospital care for any number of medical reasons. Just to kind of think about where we are overall, currently in Mississippi, we have over 57,000 confirmed cases that we've reported in the state, confirmed and probable cases, and over 1,600 deaths in the state. Thank you, Governor.
Thank you very much, Dr. Byers. It's good to have you back. Dr. Dobbs is got a previous engagement today, and so he'll be back the next time we get together. At this time, I'm going to turn it over to Director Michelle for his emergency management update.
Thank you, Governor. Good afternoon, everyone. Commensurate with the increase in cases, we still are heavily engaged in our PPE deliveries across the state. As of tomorrow, we will have made 146 deliveries to our Tier 1 facilities to ensure that they maintain the appropriate level of PPE. And in addition, we continue to run hotshot missions to those places that have flare-ups and immediate needs, continue to be on the road. Our National Guardsmen doing an outstanding job continuing to support this mission. They have to date broken over 200,000 miles of running up and down our Mississippi state highways, getting this PPE out where it needs to be. So they've done a Herculean effort in supporting this, and very proud and very thankful to have them as part of this mission. As promised, we have successfully completed the beta test on our COVID Emergency Relief Fund, the CARES Act track that we've been talking about over the course of the last 2 weeks. We have that ready to go. It will launch live on Monday, as promised, August the 3rd at 9 a.m. In conjunction with that will be our call center, will be manned by 6 personnel from 9 a.m. until 3 p.m. Monday through Friday. We will monitor that. If we need to extend or modify those hours either throughout the week or on the weekend, then we will do that. This is a flyer that basically will go out. I am not going to publicize the phone number today because I don't want, through miscommunication, people start calling a deadline and then create additional frustration. We will message the phone number for that throughout the weekend. I will message it again very heavily should we have a press conference on Friday, but we will push this information out. As always, my website, msema.org, has all the information, very good tutorials, step-by-step, of what is available, what is acceptable under public assistance, and what is eligible under the CARES Act funding. Great tutorials there, and again, the call center will be open as of Monday morning, 9 o'clock. Real quick tropical update. Tropical storm Isaias Yes, I studied that to make sure that I pronounced it. I still don't know that I got it right. But Tropical Storm Isaias continues to move on a northwesterly course across over Puerto Rico, vicinity of Puerto Rico now. And currently, the projected track would take it to the eastern side of Florida, then out into the Atlantic. But I will tell you, the only thing that has been consistent thus far about this storm is inconsistency. So we'll continue to watch it. It currently does not pose a threat. But I will tell you, and I will tell all Mississippians, particularly those who are on along the Gulf Coast, this time of year, a storm that gets this close, it could very easily get into the Gulf, and if it does, then it's anybody's game. So continue to watch this storm closely, and we'll continue to keep you updated. And finally, we did get another tropical wave that came off the west coast of Africa. We'll be watching it over the next week or so to see what it does. But as always, we must be vigilant in addition to everything else that we're doing here in Mississippi. Sir, that concludes my update today, sir.
Thank you, Director Michelle, and a special thank you to your entire team, along with the Health Department, for the work that you're doing. I am very, very proud of the work that's being done by numerous state agencies. The fact is that there is a significant amount of work that has to be done, and the administration of so many different CARES Act programs has certainly led to additional work for everyone. And I want to thank you and your team, the Health Department, and all of state government for stepping up to the plate and doing just a little bit extra to help your fellow Mississippians. With that, I'm going to open the floor